Many of us think of therapists as these experts that sit in these chairs and say like, there's a distance there. They have to be an expert. They need to have a PhD. They're a doctor. Maybe you lay down on a couch, and you talk about your mother. And that's historically, that is what therapy was about. But therapy's changed a lot. So there is a good therapist for every person out there. You might be the kind of person that does need someone who is an expert that you can trust, that is a doctor that you can go to. And if you know that that's the kind of therapist that you need, then you would look for someone who might be a PhD psychologist or an MD psychiatrist who prescribes meds as well as provides therapy. If you're someone who knows that having an expert tell you what to do is going to turn you off, then you might be looking for a clinical social worker or a LPC, which is a practicing counselor. I would always recommend that you ask a family member or a friend if they have great therapists they can recommend. And then you can even create a list of questions. I like to think of it as interviewing. What's your experience in working with depression? How successful are you in working with depression? Do your clients get better? How long do your clients stay in therapy? And then the most important thing is you go for your first appointment, and that's really an interview. You get to decide whether you feel comfortable with that person, and if you don't feel comfortable, you don't have to go back. You can find a therapist that you feel really comfortable with. I'm Louise Newton, LCSW, SEP, with Carolina Partners in Mental Health Care, and I want you to be well.